Hey, we need to sing my song. Y'all know my song? I am just getting the day started with the doctors. We got a few exam rooms coming in, just seeing morning patients. Overall, it's gonna be a good day. Today's gonna be a good day. Oh, okay, I love it. Oh, I see your shoulder.
Zoe, come here. Let me take your hat. Come here. Let me take your hat. I brought 15 of my Chi Angels in to get vaccinations. My angels are all I do. They have tons of collars and harnesses and clothes and coats and they're my life.
What's up, everybody? What's up, girl?
Hi.
How are you?
Hi.
My longtime client, Angie, is in today with her 15 Chihuahuas. And despite their small size, they're kind of a big deal. That's my favorite costume. These guys are local celebrities, and they love to dress up and go visit our local community nursing homes. So it definitely gives me some extra motivation when caring for them. Your other baby we saw yesterday that had parvovirus is doing much better.
I want her to be
We're
okay.
trending in the right direction.
I have 16 and one is parvo, so I'm in here today to make sure the rest of the kids don't get parvo.
All right, Paula, we're gonna have the whole thing. Let's weigh them. Parvovirus is an extremely infectious disease that can be spread from dog to dog really easily, and it oftentimes can be fatal. We're currently treating Angie's 16th dog for parvovirus. Luckily, we caught it in time. Hey, cutie patootie. How are you? I'm doing a physical exam, checking these guys for possible parvovirus since they've all been exposed. Then we're gonna update their vaccinations to prevent any spread. Come on, all y'all, get in line, grab a puppy.
Their names are Precious Baby Chi, Zoe Sweet Pea, Mozzie Zane, Tika Faith, Arabella Hope, Tiny Adorable Yoda Man, Kisses, Mia Bliss,
I love the hat.
Halo, Maggie Mae, Harley Cash, Twilight, Rain, I call her Rainy, Isabella, and Emmy. The one that's in the parvo wing is named Heavenly Gemma Star, and she's awesome.
Nobody has signs of parvo, so that's a really good thing.
All right.
Everybody's eating, everybody's playing, everybody's doing well, so we're just gonna make sure we keep them healthy and hopefully get the other baby home real soon. All right.
You did so good.
The whole staff came out.
Did they all get their shots?
They all
Did
got their
anybody
shot.
cry?
Nobody's crying, so everybody's good. You know, it's just still on your other baby. We're going in the right direction.
Thank you, thank you. I'm feeling good about today, but I'll be really happy on Friday when I get to pick up my little Gemma when she really beats parvo.
As always, and it's all good news.
I need to keep them in good health. They need to live forever.
Well, you know, we really got some amazing animal people in our community.
Yep, you gotta love the positive clients that come through our door.
No, with the puns. I'm really serious. These folks do a great job.
Yeah, no, I'm serious too, man. They love people and they love animals.
And it could be a dog, it could be a cat, it could be someone with 15 Chihuahua puppies.
But at the end of the day, we're all neighbors and we're all in this thing together.
Except when it comes to cleaning up all their poop.
Okay, Ducky.
A good Samaritan brings in a baby duck who needs help getting back on his feet.
Hello, how you doing?
I'm good.
Who we got here today?
Cheese and quackers.
Cheese and quackers. You came up with that?
Mm-hmm, on the phone.
Oh, really?
I was on the phone with the receptionist, and she asked me what the name was, and I didn't have a name yet, so I just said quackers, and then I said cheese and quackers, and now he's cheese and quackers.
So what's going on here today?
On my lunch break, I was coming home, and I saw the big line of baby ducks and the mama duck.
Yes.
And then he was falling behind, because if you look into his leg, one of them has got something going on with it.
Okay.
And there were two cats eyeballing him, and I couldn't let it happen.
I got you.
Holy.
There were two cats slowly creeping up on him, and I knew it was only a matter of time, so I figured I'd go ahead and just scoop him up and take care of it.
What you gonna do with him?
I can't take it, because right now we're in a 1-bedroom, 1-bath, and he's in the bath.
You probably feel good about that.
Yeah.
So you can see when I look at this one, how when I push out, we kind of open our way up. This one is unable to do that. When I open it, see how it kind of stays curled up. So we can put him down here and see if he can at least walk, can even use the leg. Yeah. So I want to take some x-rays here so I can kind of see what's wrong with the bone. I don't know if it's something that he was born with. It could have been an injury that's happened and hopefully heal up and we'll regain function, but we need a visual of what's going on there. Upon this exam, Cheese and Quackers came in a little bit concerned. That leg is really contracted back, and it really depending upon how long it's been like that, whether it's something that's congenital or whether it's injury, if we can do anything about it.
Good job.
So what I'm looking for is to see if I see any obvious abnormalities. I don't see anything, I don't see whether any fractures or anything, and I also don't see whether there's any bone lysis, meaning that the bone is starting to deteriorate, which could indicate some kind of mineral issue. This seems like as though he can do this. He just can't do that.
This is not going to be an easy fix. Like when you have a fracture and you can just set the bone, I'm not even sure if this can be fixed at all.
When I stretch it out there, it should flex that up automatically. See, it's frozen. So the injury probably was right here or it was born right there. Because see, that one.
Ligament issue then?
That's what I'm thinking, a tendon or ligament.
This guy's going to need a lot of specialized attention. And if he doesn't get it, he's not going to be able to survive in the wild.
Oh, no. It's okay.
Hey.
A gargantuan goldfish makes a splashy entrance at the clinic.
We brought in our goldfish that our daughter Maria brought home from the fair almost 9 years ago.
Everybody that sees him goes, "That's a goldfish? Is he?" And I'm like, "Yeah, he's been around. He's a survivor."
We love him.
How y'all?
Good. How you doing?
Y'all doing all right?
Yes, sir.
So who we got here?
This is Klaus.
Klaus, all right.
Klaus came in today for tumors.
Tumors he's had for a while, yeah.
Let's take a peek. That's a huge goldfish.
With some huge tumors.
Goldfish can get quite massive. Some of them over 12 inches in length. They're also prone to these tumors called neurofibromas, which are typically benign, but they can get really big. Has his appetite changed any?
No, not at all.
How fast would you say they've kind of grown?
Not terribly fast, but...
I'd say over the past 3 years it's probably started.
The first one started maybe 3 years or so ago.
Right over his gill, one of them, huh?
Yeah, that's the one that worries us. Because that's how they breathe, isn't it?
It is, yes, ma'am. Looking at these growths, they're really huge, especially for a goldfish this size. I'm sure they're causing some kind of discomfort. I gotta get rid of these right away. All right, so what I'll do is put Klaus in his own kind of anesthetic bath. I got a electrosurgical tool that cauterizes, meaning basically stop the blood and cuts at the same time. Hopefully we can get these tumors off. Hopefully my buddy here does well, and we'll get it done.
All right.
All right.
Deal.
Thank you, sir.
All right, no problem. We definitely got some tumors there. I'm very concerned about the ones on the gills, which is how this fish breathes. So I gotta be really careful. Klaus is definitely an older goldfish, and older animals are more sensitive to anesthesia. That definitely makes this more intense. A lot of added pressure there.
All right. So this is my fish anesthesia delivery system. Make sure everything is sealed and drop it in the water. Go ahead and add this.
Night, night, bud.
All right. Put my anesthesia into the water, and away we go. I think he's already getting sleepy.
Come on, bud, go to sleep. So what I'm doing is just moving him back and forth in the anesthetic water because, now he is not really able to swim. So to keep oxygen and the anesthesia going across his gill, you have to keep him moving.
Is he good?
Yeah. All right, let's go ahead and deliver your anesthesia. Start pumping water through. So that's gonna deliver anesthetic to keep him under.
Hold on 1 second.
How we doing, boss?
Come on, buddy.
What you got? What's going on, Paul?
We got a leak.
Ooh, boy.
Yeah, we need to get him back. Open that.
Looks like the tube that we're using to deliver this anesthesia to Klaus has sprung a leak. So we gotta get this fixed, or otherwise we won't be able to keep Klaus under during this procedure.
Come on, buddy.
Night, night, come on.
There we go. Yeah. And just go all over his body.
There's 3 tumors that we have to remove. This is bad, it's right over his gill. Ooh, boy. How we doing?
Doing good. Still got reflexes down here.
All right, let's flip.
Let you know my motto. Get him off the table. Hello, Klaus.
That's 3. Let's go. Let's wake him up. So the surgery went great, but now it's time to wake Klaus up. You know, it's not like us waking up from anesthesia or a dog where you remove the endotracheal tube and you breathe in air and you breathe out air. In this case, we got to get water across the lungs, so I need fresh water that doesn't have anesthesia. So I moved Klaus to the recovery tank. Not breathing on his own yet?
Not quite.
So you always worry about anesthesia with, I don't care what it is. Come on, brother.
Your hands are probably better than mine because I still may have the anesthesia. Come on, buddy.
It's crazy. Come on, bud. Wake on up, bud. There you go.
All right.
Welcome back to the light. Super happy that we were able to get Klaus through that surgery. Anesthesia is usually the biggest thing, and with our anesthesia delivery system, we've been really successful with being able to put aquatic animals down and wake them up. What's up?
How you doing?
I'm all right.
Holy moly.
So what I did cauterize and do electrosurgery around it, so that area will start to slough and fall off over the next few days. He's recovering. Come back, we'll take a look.
Okay.
This is the tank that we put anesthesia in. And then probably the last 15, 20 minutes, what we've been doing is letting him recover. I gave him an antibiotic injection and a pain injection. He's starting to right himself, so.
He's a survivor. Yeah.
We got these growths off, and just like with people or dogs or cats, there's a chance these could possibly be cancerous. But the main thing is, I want to make sure that Klaus is comfortable and that the owner gets as much time as she can to spend with her amazing goldfish.
All right, let's put it in.
Dr. Hodges is a rock star. He did great for us and for Klaus.
Thank you so much.
No problem.
We'll hopefully have him for a long time. We're going to love him till the end.
Absolutely.
All right, buddy.
Is there any fracture or anything in there?
I'm finna look at. I looked at it. I don't see a fracture.
It may have been something that he was born with. There's probably not a whole lot we can do about it. He needs to be somewhere that he can get attention and be able to exercise that foot.
My mother-in-law may can take him. She's got a bunch of ducks. You need to call her?
That's right. Doesn't your mother-in-law rehab ducks? This little baby would be perfect for her.
Hey, you got a second?
Yeah.
Okay, so we have this baby duckling, and he has a bad left foot.
And it doesn't appear to be something that's new, like a fracture now. It's whatever it is, either is more than likely healed or was born like that. So basically, we kind of need a rehabber that can just give him a chance. But I think it needs to be someone who, you know, of your expertise.
We can try it, see what happens.
All right, we're gonna love you for it even more, okay?
I'm sure you do.
All right. Thank you.
All right, bye.
All right, bye-bye. When we have rescue situations like this, we normally don't follow through with adoptions or the rehab process. But in this case, the stars have aligned and the people in the community have stepped up.
This is what we're gonna do. So we called Jordan's mother-in-law. She's rehabbed ducks before, so she's experienced with them, which I think would be a great thing because
yeah.
But my hat's off to you for bringing this baby in to even give a chance.
I'm very relieved because knowing that somebody that has experience with ducks knows how to take care of a duck is definitely a lot better than me figuring it out. Thank you very much.
All right, yes, sir, no problem.
I feel a lot better now.
All right, no problem. Like I said, I thank you for bringing it in, and we're gonna do our part from here.
You fixed. I brought my rabbit, Jack, in today. He's having some issues down below. I've had him a little over 7 years, and I've grown attached to him, and I just love him. He's a sweet boy. Hey, y'all.
Hello, how you doing?
Hey,
how are you?
Good. How are you? Doing good.
Doing great. We got the man Jack here.
Yeah, my little old boy.
So what's going on with Jack?
I feel like he's got like maybe a UTI or something going on. He's trying to go a lot, like he's trying to go.
And not a lot coming out?
And it just kind of drips out.
Okay, we got to see if
got a little something going on, poor little thing.
Okay.
See?
Oh, yeah.
I know.
Maybe I'm a little...
I feel terrible.
Yeah, he's a little irritated there, too.
Rabbits are notorious for having urinary problems. It sounds like my buddy Jack is having urge dysuria, which is just a fancy word of saying I have to pee all the time. We need to find out the cause of this. First, I want to start with an x-ray. And the reason I do, these guys are prone, they can get bladder stones, but they can also get what we call sludge in the bladder, which is kind of a calcium buildup they can get. And we're gonna take old Jack back and get a quick x-ray, and then we'll come in and we'll go with that with you. I think he feel like he at home now, ain't he?
I know, look at him, he's just relaxed. Hey, good boy, Jack.
All right, be right back. Initially talking with the owner about Jack and taking a look at him, I'm a little bit concerned. If something like bladder stones or sludge, it's a little bit more serious. You know, we're hoping that we can take care of this without doing surgery. So hopefully in this case, we just have a urinary tract infection and we can treat that. So fingers crossed. So Jack the rabbit, how did he get here?
He hopped here.
No, airplane.
Bye.
It happens every time. I'm so funny, the audience just leaves. Yeah, I don't know why. I'm just that good.
It's all right, baby.
Eat nothing.
Come on.
No. Sludgy, sludgy, sludgy. What I didn't want to see is a big white area right there. So that's actually the bladder, but the bladder has sludge in it, which is like a calcium material in it. All right. I didn't want to call you back here for x-rays. I was hoping it was normal, and I'll just say, look, everything looks normal with Dylan. But
I didn't want you to either.
yeah, this area right here, that's the bladder. And it's a lot of sludge that's in this bladder, and basically kind of calcium kind of make up this sludge. Small amount of sludge can be normal in this rabbit. When they have a large accumulation like we have, it definitely can cause a problem because the sludge is taking up a lot of space inside the bladder. And we don't want it to accumulate anymore because if it accumulates more urine is there. The next organ up is kidneys. We don't want to get kidney failure in this guy.
Really?
Yeah. So what do? The first thing we try to do over the first 48 to 72 hours is we give them fluids. We just give them sub-Q fluids, and we try to hypersaturate them.
Right.
So that it goes through the kidney, goes to the bladder, more fluid in there, picks it up and push it out the bladder.
Flush it out?
Yeah. So the baby's going to have to be hospitalized.
Oh.
If it does not improve, there are times that we have to surgically go in there. Now, being, 7 years old?
Pushing 8.
Yeah, we're not necessarily the best surgery candidate because of age.
Right.
But let's hope we don't get to that point.
We'll hope for the best.
Yeah, we're gonna keep our fingers crossed and we'll give it a shot.
Thank you.
Yes, ma'am. All right.
I know you do your best.
Yes, ma'am. Sure will.
Anytime I bring any of my animals to the vet, I don't like to leave them overnight. I want them to be home with me. Oh, buddy, I'm so sorry.
It is
You're
okay,
gonna
Mommy.
get better. You're gonna get better. I will definitely say a prayer for my little buddy tonight. I hope he's gonna be all right.
Good job, buddy. Good job.
These next 48 hours is going to be critical. You know, it's going to determine if, Jack can go home or Jack may need surgery or, hopefully, which is not the other outcome, and it's survival. We're at the point now where we're trying to figure if this baby going to get through this process or not.
Baby Drake, I love you, but man, you got some bad gas.
This young Frenchie lost his footing after being bulldozed by another pup.
I'm bringing in my French bulldog. His name is Drake. He's about 13, 14 weeks old. He was outside playing one day. One of our German Shepherd puppies actually ran him over, didn't have any brakes. He wasn't using his back legs very well. He was limping a little bit.
Hey, you.
Hey, good looking.
What's going on your way?
I'm going. So we wanted to bring him in to Dr. Hodges and get him checked out.
What's going on with this baby?
So he was outside using the potty, and one of the German Shepherds ran him over in the middle of him doing his business. So sometimes he walks okay, and then sometimes not so good.
All right. Go over there and see your mama.
Come here, buddy.
Oh, boy.
Yep.
Don't like that.
Nope.
We're eating pretty good still?
Oh, well, yeah. I mean, he's not showing any signs of distress.
Still.
I mean, he eats streaks.
All right, I'm gonna go check that pelvis. I'll be back, okay?
You're good.
Come on, puppy dog. Definitely isn't good with Drake. I mean, he's dragging that leg from the back, showing a lot of pain on that right side. You always worry about injuries to growth plates and puppies, so. Hey, what happened? This isn't just any claim. This is Dana. I met Dana during my time of distress. I was in a pretty bad car accident about 8 years ago, and Dana, who is an EMT and serves his community well, was actually my EMT. I was in a lot of pain. She drove me to the hospital.
We got to talking and found out what he did, and I had a puppy. He's like, come see me, and I've fallen in love with him ever since.
Your leg hurt? I got you. Dana was there when I was in pain and I needed her, so, you know, it definitely gives me great pride to be able to help her when she needs me.
Let's see what we got going on.
Ooh, boy. Well, the good news is we didn't break a leg. We definitely got a growth plate separation. We looked up.
Okay, good.
Separate our growth plate a little bit. It's the normal plate, so it's just separated a little bit. The growth plate is an area of connective tissue in puppies where new bone is formed. And when that German Shepherd knocked this baby over, the growth plate's separate. You know, I think that'll heal on its own.
Okay.
No breaks. So the biggest thing is we just need to keep this baby from walking on that leg for a few days. In your arms, or I can keep him in my arms.
Yeah, I hear you. I hear you.
In your arms, and then just kind of cage rest, and this should be fine. But no fractures. This hurts. Hey.
Yeah, I could definitely tell he's...
About like me that day, you got me the back of the ambulance.
Yeah. So I am super excited that we're not going to have surgery. We got the best case scenario. I'm very glad that he's getting to come home tonight.
The beautiful thing about this community is you get to treat your EMT dogs, your banker, your butcher. It's just a tight-knit community. They kind of reciprocate and see each other. So, you know, it definitely is a sense of pride to be able to treat my EMT's dog. It was really cool to be able to repay somebody who just takes great care of our community by taking care of their pets.
Yeah, you know, it's really cool when it comes full circle like it did with you and your EMT.
Exactly. Fortunately, she took good care of me. She even ran a few red lights for me.
But that gets me thinking.
What's that?
How many police dogs you going to have to take care of?
Probably a whole lot.
You good, Tilly?
A giant Schnauzer's in for a chronic issue that's as intense as her affection for her owners.
I brought my dog, Tilly, and today she just loves unconditionally. She gives you love all the time. I've never been kissed so many times in my life by any animal or any person.
So we got today.
This is Tilly.
Hey, Lily, how are you? So what's going on?
She's had UTIs from the time she was a baby.
Yes,
okay.
yeah.
She's never not had one.
She's never not had one, yeah.
I just keep buying the medication and, you know, it's not doing anything.
How old is she?
9 months.
9 months, okay. You know, having multiple urinary tract infections at 9 months old is not a good thing. So we're going to take a look here, okay?
Okay.
And we'll see what we can do for it. Yeah, is everything good? You got to check me out?
Thank you.
She's very, very, very protective of me. I mean, she doesn't like people approaching me, but...
All right, got you. All right. So this we're going to do. We're going to walk her to the back.
Okay.
That way she's not around you and she don't feel so protective there, okay?
Can you slip this on her? With that hole, in that hole.
All right.
You didn't take this one off?
No, yes, sir.
Is it because of the antibiotic that she's been on is resistant to the bacteria that's causing a urinary tract infection? Or is it because of the duration of time she's been on the antibiotic has not been long enough to take care of the infection? Whatever it is, we need to find out before it causes permanent damage to the urinary tract. Straighten your leg out. Okay.
So dark in there.
When we look here, you see we can't actually see the vulva. It's up under here. It should be open here so that when we urinate, it kind of falls out, but now it kind of collects there, and that's why we get these reoccurring urinary tract infections.
So wait, Doc, you're saying it's recessed?
That's exactly right. Tilly has an inverted vulva. On examination, it becomes pretty obvious that Tilly has an inverted vulva, which is not uncommon in dogs. We mostly see it in large breed dogs. In this case, the folds of the skin is holding the urine, which is causing the pain and the urinary tract infection. All right, let me go talk to him and see if I can get my old trusty pen out and draw a little
picture?
something. Yeah. All right.
Good luck.
All right. Mystery solved. Tilly has an inverted vulva. They get the urinary tract infection because the urine is not escaping like it should.
Right.
So we need to try to get it corrected. What we need to do is a procedure, episoplasty, or we call it vulvoplasty. Now, I'm gonna try to draw this thing the best I can, okay? At least what we have to do here. So it's rolled under, so basically what I have to do is I have to go here, make an incision. Then I make a second incision, and we take all this out. And it'll be one line here that'll have stitches in it. Okay?
Because you took that part out.
We took the excess out. We got to get some relief, though. This baby has never had a urinary tract infection.
Yeah.
We need to get some
That's
relief.
what I was telling him. I said, if you've never had one, it's horrible.
Because of how bad this thing is, we need to take Tilly to surgery as soon as we can.
What'd you draw? 2 mountains. Caves in them.
Legs, tail.
Oh, these are front legs.
No, they're back legs.
I see mountains.
Use your imagination.
What, did they know what it was? Did it make sense to them is the question?
Of course they did.
Okay. All right,
Yeah.
you say so.
Their imagination is just good. Better
right?
than yours, I guess.
Okay.
I'm Picasso.
My drawing clearly shows how I outperformed the vulvoplasty.
See if we can evert that vulva back out again so it's not sitting under there, so we can help eliminate some of these urinary tract infections that this baby's having.
What do you think?
I'm gonna secure Tilly's tail back. That way Dr. Ferguson has full access and he won't miss anything.
Thank you. Whatever you do, watch for the back.
Yep, I'll be careful. She expressed her inner glands all over you, huh?
Dang.
Thank you, Paul.
What'd I do?
Today has been a pain in the butt. You say that again.
I've taken a little tissue off.
You think it's good?
No.
I'll take some more off?
Yeah, I think so. I think I got enough off now. It's just time to put it together and make it work. This baby's young. The baby is 9 months old, so it still has some growing to do, so I do have to leave a little room for growth, but we're definitely going to be better than we were when we came in.
You done?
Yep.
What it look like?
It looked like a vulva back there.
Okay.
So we got Tilly's surgery done, and we took a pretty good amount of tissue away, but everything went well. So the plan is to get her, in recovery and get her awake and discharge her this afternoon. Overall, I don't think it could have gone any better. All right, how's it going?
Good, how are you?
So we're back. Everything went well.
Good.
Okay, so that's after there.
Oh, wow.
Even now it's kind of inflamed, but once the inflammation and everything go down, it's gonna definitely be a lot better. So we
It
got
looks just like the picture you drew.
Thank you. You need to take.
It does.
You make sure. Hold on.
It really does.
Because they gave me so much rip about my picture back here. I need Dr. Hodges. They have something to tell you.
How y'all?
Hi.
I showed them the picture, and what did y'all say?
It looks just
exactly
like his
the
drawing. Mm-hmm.
Y'all flattering him. He is a great surgeon, and that does look like a good job. Yeah. Now that picture. No thank you. That look like too much.
Gotcha. It's cool. My drawings don't have to be universally loved like my surgery skill. Everybody didn't love Picasso. So we got a couple of medications going home with you. One is an antibiotic, and the other is a pain and an anti-inflammatory medicine, okay? We did have a urinary tract infection, but the antibiotics we're sending should help with that too. So we need to, in about 9 days, 10 days, come in and then we'll remove those stitches. And just make sure we're heading in the right direction on this UTI.
Okay.
Okay?
She's so excited. She's so excited. Right here, right here.
Tilly. I'm so happy because I know she's going to be happy.
Oh, she's so excited to see y'all.
Baby. She'll get ice cream. So she loves ice cream. So I'm going to hold a cone in there and just let her lick until she's done, and that'll be her treat for the night. What's this thing on your head, huh?
Good job, though.
Come on, hold on, Paul.
I got work to do.
I got a rabbit over there. Do you know how the rabbit got here?
Yeah, on the brother.
No, it's by airplane. Open to. What's up, buddy? How are you?
It's awful cool in glasses. Drake, the cute little French puppy with the dislocated growth plate is improving. Back in for laser therapy. We're gonna make you feel good. Ready? All right, so we're doing a little laser treatment on the baby. Laser brings up the oxygenated blood to improve some healing, helps take away the pain, reduce the inflammation. We're gonna just do one laser therapy on them. Okay. All right. So who wearing best, Paul?
Gotta go with the dog, man.
You gotta go with the dog?
Gotta go with the dog.
I agree.
A dog. We doing our who wears them best.
Puppy.
What kind of employees I got? Chicken. What's that? That's what we want pee to look like. Or technically urine.
Hey, look. fella. You're a cute little baby. Look at you. What's your name? Your name is New Kitten. What's up? You look like a Cosmo. Yeah. You good? Who is that little rascal right there? And tell him your name is not Bernard. Yeah. It's not gonna be Bernard.
I would agree. It's gonna be a Bernadette.
It's okay, baby.
A mourning dove arrives with its feathers in an uproar.
I'm bringing in my pet Speckle today. He's like my baby. We go all over the house together. He's just real special, real sweet, and, you know, I care a lot for him.
Hey, hey.
Hey.
How you?
Pretty good. How are y'all?
I'm doing well. Talk to me a little bit about Speckle.
Yesterday, he had a night fright, so he fell off his perch and freaked out because it was dark. I was like, well, maybe he's fine. And I picked him up this morning, and he seems to have twisted his wing in his cage.
All right, Paul, let's look at Speckle.
All right, Speckle.
Good luck trying to catch him, because he is... Here, pull toward him. There he is. He is one tough baby.
It's all good.
Come on, Speckles.
Hey, Speckle.
Come on.
Hey, Speckles.
There you go. Yeah.
I'm gonna look at a picture of this and see. I think it may be fractured. It's definitely really swollen. I'll be right back, okay?
All righty.
Come on, Speckles. It's not uncommon for domesticated birds to injure themselves while in their cages. And in Speckle's case, I could definitely see there was some bruising and some areas of crepitation where the wing bone was moving. It's a good chance that we could have a broken wing.
Have you hold the other wing. Ooh. Oh, you see that?
Mm-hmm. Come on over there. All right, we're gonna blow it up. It's fractured in 3 places.
He sure did.
So, give me a second. I'm gonna see if I can put a bandage on it. And we'll see if we can get you healed up.
All right, sounds great.
So Speckles has broken her wing in 3 places. A bird with a broken wing definitely doesn't have much of a quality of life. This is not like a broken leg in a dog or cat. Birds have small, hollow bones that are really hard to heal. I have to figure out exactly how I can immobilize this wing so that these bones can heal properly. All right, Speckles, easy. Get your feet right out. Speckle's wing may be broken, but that doesn't mean he may not try to fly. If I don't immobilize that wing, these bones will shift and cause even more damage. All right, Polly, you are going to.
Yes, sir.
No, I need to be right. No. Okay. First, I'm gonna kind of immobilize my bird. We're gonna use vet wrap, which is a non-adhesive tape, to immobilize Speckle's good wing and keep him from scratching us. Just get it ready. There you go. Go around. You can tear. All right. That's all right. Then we're gonna immobilize that just around the feet there. There we go. Now we immobilize. Your old man did a little something, huh?
Yeah, you had me with that one.
Give me some scissors.
Like bandage scissors?
Mm-hmm. I need to somehow hold these bones together. And since they don't really make dove-sized split, I'm gonna channel my inner MacGyver to figure out something to help this bird. Tongue depressors. Stink, Polly.
I've seen it all.
Okay, so now we have our bird split. You can take your other stuff off. You know, in veterinary medicine, you have to try to figure out the best way to do the best job that you can for your patients. And in this case, we just put a splint on the bird. Sometimes you gotta wing it.
All right, Ferguson.
All right. So I took these out. So if you feel this hard, then
All better.
I got 2, one on this side, one on this side, okay?
Okay.
So the bird is able to function, do whatever it wants. It can flap if it wants, it can do whatever it wants. We're just gonna leave this on and it'll be fine. Let's take a look in 2 weeks.
Alrighty.
He got a nice bruise under there, but he should be fine.
Fantastic.
You take care.
Thank
All
you
right.
so much. You too.
No more nightmares, Speckle.
Yeah.
I can tell this owner loves her bird. I can tell she takes great care and will do whatever it takes to make sure her bird is healthy and doing fine. So I have no doubt that Speckle is gonna bounce back and be flying around in no time.
I'm definitely looking forward to getting him home. Hopefully it'll heal up nice and he'll be on his wings again soon.
Okay, Jack, let's see what you've given me today. There you go, see? You can even see like the little sludge that's in there, the little speckles there. Jack the rabbit, it came in a couple days that we found he had sludge in his bladder. He's looking real good. He's been urinating well, so that means that we are clearing some of this sludge out. You're doing good, Jack. You might just get to go home today. But x-rays are coming up. Keep your little toes, fingers crossed, okay? We're gonna shoot some x-rays this morning just to get a gauge on where we are, and hopefully it's a little bit better.
Oh, looks better.
We ain't got that big white spot down there like we did. Look at my man. Can a rabbit give a high five? Bam. All right. Looking at the x-ray here, of course, all the sludge isn't gone, which I didn't expect it to all be gone, but if we recall on the initial x-ray, it was a lot whiter here at the bottom here, and now you can see where some of the sludge is suspended, which means that it can float a little bit, it'll head out. So I think Jack may be able to go home this afternoon. Mom's gonna be so excited. Where do rabbits go for haircuts?
No, Doc. I'm so excited to come and get my boy. I really was kind of thinking he might have to stay another day or two, but he's doing so well, and I get to take him home.
How you doing?
I'm good.
All right.
Hey, buddy. Hey,
We did
sweet
great, so
boy.
hey, mommy. So we got medicine for you.
Okay.
We have a pain anti-inflammatory medicine. We have one that's a diuretic because I want to urinate. We're still
Right.
passing this stuff out. We have a citrate. It helps pick up the calcium, and the calcium what is in that bladder. And we got antibiotic, right? Food.
Yeah.
So it's mostly Timothy hay. Other hay, it's got too much calcium product in it. We want to kind of limit that a little bit, okay? Other than that, we did good. We want to kind of take a look here, maybe in a couple weeks, to see how we're doing. I'm just glad we're doing good and going home.
I am too.
Yeah.
I am too. It's been a long 2 days, but I'm very excited to take my little boy home. Thank you.
All right.
Thank you, Dr.
All right,
Ferguson.
we'll see you in a couple weeks. Definitely feel good when you have a success story. You know, Jack came in with some issues that I was really concerned about, but he pulled it through this thing like a champ. I'm definitely a happy camper.
He's stuck on my thing in my hair. Okay, here we go. Yeah. Thank you. Thank you.
An animal advocate arrives, toting her 2 rescue reptiles.
I'm bringing in Finnegan, who's a bearded dragon, and Goose, who is a tegu. Both are rescues, so I just wanted to get overall health checks on them.
How are you?
Hello.
How are you?
Good, how are you? I actually have 17 rescues.
Let's look at the goose. Oh boy, we're worried about those kinks.
Yeah. I have no background, no history. SPCA LA, they needed some help. I ended up stepping in as a foster and ended up failing.
Meaning now that they're your pets?
Yeah.
Did you just move here from California?
Mm-hmm.
Well, welcome then.
Thank you, thank you.
When I see kinks like this, I always worry about low calcium.
Okay.
So, kinks in a tegu's tail can occur because of hypocalcemia or low calcium. They also can occur because of trauma. So I'm gonna take an x-ray so I can figure out exactly which one it is. Who you got here?
This is Finnegan.
Finnegan, right?
Uh-huh.
Finnegan.
Call him Finny.
Fanny.
All right.
Initially, when I got him, he was thinner. I had to syringe feed him. He wasn't eating properly.
Ooh.
He's eating well now. I don't feel like he's picking up as much weight as he should be for as much as he's eating.
Okay. So, you see this yellow area? How long have you noticed this yellow?
That's recent. The yellowing around his mouth and the eyes.
As I'm taking a look at Finnegan, I see a yellowish color and some flakes on Finnegan. I'm really concerned about those. The reason I ask is sometimes I get something called yellow fungus. And it can be really bad.
It's like, oh, that sounds gross. Okay.
And it's not only gross, it can be fatal. But you notice the yellowing? Yeah. I'm gonna scrape and just kind of see that. Finnegan's color, flakes, and weight loss all point to yellow fungus. Yellow fungus is often associated with stress and lower immune system. And it's usually found in crowded or unsanitary type conditions. Michelle rescued Finnegan, so we don't really know the history or where this baby came from. Give me 1 second, okay?
Sure.
I'm really worried about that tail, so what I'm gonna do is shoot some x-rays and kind of see exactly what I got going on. And in the meantime, I'm gonna do a skin scrape on Finnegan to definitively diagnose yellow fungus, but I'm 99% sure that's exactly what it is. We definitely got a broken tail. I mean, it literally, look right here, it literally snapped. It's going like this. So when I take a look at this x-ray, I mean, it is plain as day. The kinks in the tail are not caused by low calcium. This tail is definitely broken. Come on in, dear. So, was it kind of like this when you got it? Mm-hmm. So it literally snapped in half.
Poor baby.
You see this should be joined right here.
Okay.
It was broken in half, and what's happening is the body's starting to remodel and try to heal. Mm-hmm. Over time, it may straighten a little, but it's just gonna have to heal naturally. There's not much I'm gonna do with Goose's tail. I'm just gonna give him some anti-inflammatories for pain, and just let this tail heal on its own. Now, your other problem. I do think that's yellow fungus.
Oh, no. Okay.
I'm a biopsy and look, but what happens is sometimes it gets stressed out. The fungus start to come out, and they won't thrive. They'll look like they lost weight. We're gonna get antifungal medicine and see if we can get this control. It can be bad. So you're doing a good job to get it to eat. No, seriously.
Okay.
First of all, do you bathe this baby much? Mm-hmm. Good. Keep bathing. Any scabs and scales, go ahead and let's kind of clean those off, because that's gonna help get the fungus off. I got some itraconazole, which is an antifungal, and then for a Goose, I got some pain meds.
Okay.
You know, I think it's just gonna be some TLC. He probably was stressed and it started to come out, but I think you're on the right road.
Okay. I did just throw them all in a van.
Right.
And drive them from California to Georgia. You know, so a little stress, not too much.
What'd you think about Georgia?
I like Georgia.
Do you?
I like it out here.
Well, it is a pleasure to meet you.
Thank you, thank you.
All right.
Thank you. Thank you very much.
All right.
I feel good. I feel good. Yeah, they'll be fine. Critter Fixers is amazing. I love these guys. You have the mentality that you'll fix them all. It's like, I have a lot for you to try and fix. Everyone that I have interacted with, dealt with, the staff, everybody's amazing. I love it. I love it. I'm happy I can be a part of this.
Man, I heard your MacGyver skills really came in handy.
Oh, of course, man. You know, I pull a rabbit out of a hat every now and then, but in this case, it was a dove. So Speckles is doing fantastic, flying around. Owner's super happy.
I guess you can say you're the perfect wingman.
You just had to get one in, didn't you?
You know I did.
It's been about 2 months since I brought Speckle the dove in to see Dr. Hodges. He's recovered well. His wing is doing much better. All his feathers are growing back out. It's all healed up. I'm really happy with the state of his recovery, and he is now back to being my happy, normal study buddy.
Drea, come here. I have a rabbit over here.
Okay.
You know how it got here?
How the rabbit got here?
Yeah.
The owner brought it.
No, by airplane.
Okay,
That's what I'm talking about.
I like it.
You're my favorite. You get a raise. See, y'all could have got a raise. That's all it took.
That's all it took.
The staff don't quite get your jokes, but I think you guys are pretty good jokes.
But I think my jokes are real good. I think they're very punny.
You know, speaking of, remember that duck you worked on, teasing quackers?
Yeah, that's the one that Jordan's mother-in-law took in rehab for us. We're doing fantastic.
You know, that might be another thing. Maybe we can get Jordan Mom to rehab your jokes.
That wasn't funny.
Hey, guys. Hey. Hey. What Cheese and Quackers was doing? She's doing great. How's her foot doing? The medicine that Dr. Ferguson gave her, everything got the swelling down. She turned it around. She can run, waddle like the rest of them.
One day I just came out here and she was up on tiptoes. She had turned that joint around.
Look at that foot.
That was it.
She's got some scarring.
She's got some scars, but it's completely straight. She wouldn't have made it if she would have stayed out in the wild. Jordan was confident that would have a safe place where we could give her some space to where she would have time to heal. She is a beautiful duck. She is very healthy. She's fat and happy. Love all my ducks, but her especially because I know where she's come from and how hard she's worked.
And how hard you've worked.
We've worked hard on that duck, believe me.